You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more traditional dentures. With dental implants, you can get as little as 2 dental implants, according to my first guest, that can snap in, snap out a full arch of teeth. With us, we have an expert on the topic, Dr. VanderMolen. Dr. VanderMolen, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, for people that don't know you, you have a very large, very busy practice, and I guess you do just about everything, and you focus on 3 things. But, tell me, what's a day like for you?
Well, Randy, we don't limit our practice to any particular patient.
Okay.
We see all ages, all groups of people. Our goal is to help as many people in our community to have healthy mouths.
Okay.
We can do anything from tooth whitening. We have great hygienists to clean your teeth, just regular preventive type things. We do full mouth restorations. We just do everything in between.
Okay.
My particular interests are what I would call procedures that are life-changing for a lot of people.
Hey, you told me that in the green room.
Right.
Elaborate on that.
So an example of that might be something called fast braces. Fast braces is an amazing technology that allows us to straighten someone's teeth, and it's all ages, by the way, anywhere from 3 months to about a year, and we can do that with less cost than conventional orthodontics. Another thing that we do is cosmetic dentistry. And obviously, that can be life-changing for a lot of people. It doesn't have to be a big thing. It could be somewhere where we do tooth whitening, or we could be just changing the shape of the teeth can make a big difference. Mm-hmm. Or we can go to a full-blown case where people have really worn teeth, broken chipped, they're yellowed. We can bring their smile back to what they had in their youth. Also, sedation dentistry. Not many dentists do sedation dentistry. Sedation takes a lot of extra training, but I think it's a very worthwhile thing to offer our patients, because now people who are afraid, or they gag, or they have just a lot of dentistry to do and they need to get it done, they can just sleep through the procedure and get it done. And when you have a lot of dentistry that needs to be done, obviously that can be a life-changing thing for you. Something else we offer is custom and cosmetic natural-looking dentures. If you have to wear an upper denture.
I feel like I could spot dentures walking down the street.
Right.
I told you that.
Right. And that type of situation is bad. And that's a big fear that people have. Am I going to have that denture look? And nobody wants that. And I'm here to tell you that just because you have dentures doesn't mean you have to look like you have dentures. They should have a beautiful smile. Look at this smile right here.
Okay.
That's somebody who has...
That's a denture?
That's an upper denture and a lower denture. Now, they're attached to implants, and we're going to talk about that later.
Snapped on?
Yes.
Interesting.
Now, that's attached to implants, but we'll talk about that more later. And, of course, we're here to talk about dental implants, and there's all sorts of ways to use dental implants.
So very popular procedure?
Absolutely. It should be more.
For the denture wearers?
Yeah, it should be more. It should be more. A lot of people are wandering around with dentures and they don't know. The difference between someone who is wearing a denture and someone who's wearing dental implants under a denture is like the difference between being there out there in your horse and buggy or driving a car. What do you want to do?
You call it like mushy mouth or something, because you said you love 2 implants to snap in, snap out a denture.
Right. So if someone's wearing a typical lower denture, well, first of all, 50% of the people can't even wear them. It's stuck in a sock drawer somewhere. Yeah, because your lower jaw moves, right? And if you thought about you had something just floating in your mouth with your tongue in there and the floor of your mouth and your cheeks, everything just wants to push that thing out of there. And if you could actually attach it in there, that's a big difference. That means that you can go ahead and speak properly, you can eat properly, you can kiss properly. It's fixed in place.
So when we say at the top of the show, no more traditional dentures, we're talking about no more dentures that are just laying there on glue, or
Right.
on the adhesive, I should say.
Right. And everybody hates the adhesive. Anybody who's worn a lower denture knows that, every time they eat, they're having to put that adhesive in there, take it in and out, then they eat, then they got to mess with it again, and at the end of the day, they're in there peeling it out. It's no good. Why not have something that attaches in there and is fixed, and forget about the adhesives?
So we're going to move on to dental implants.
Okay.
We said no more dentures, no more traditional dentures. And let's start with, why is it what used to take, I guess, a long time for the dental implant process now can happen much faster?
Right.
So what's advanced? Because you've been
Right.
doing it since what, 1980?
I've been doing implants since the 80s. In the 80s, it was kind of gruesome to watch. We had to open everything up, move the gums around. That's the most painful thing about implants in the past. We don't do that anymore. We have, in my office, we have a 3D scanner. We're able to image everything. We can see where the bone is, how dense it is.
So in the old days, there was a lot of cutting of the gums?
Yeah, we literally had to cut the gum and just open them up to see, okay, what's there. Sometimes there wasn't enough there, and we just put it back. Now with 3D scanning, we know exactly where it is, where to put the implant. There's a lot of cases, Randy, where I don't do any stitches. My staff has them ready, but for the most part, they're like, oh, he put the implant in, we're done. And patients are going to work. I had a patient just recently. She had all these bad teeth. She wanted to have everything done. She wanted to have it as much like her own teeth. We put 6 implants in her. We took out teeth, put some immediate teeth in so she could function. And she said, you know what, I'm going to work tomorrow. Now, we weren't quite so sure about that because we took teeth out too. And sure enough, we saw her the next day. She came in her lunch hour. And I said, you went to work, didn't you? And she said, absolutely. I said, I'm not going to miss work. And she says, I feel great. She says, I didn't take the pain medicine. I said, I'll admit I did take a Tylenol because I wasn't sure before I went into work. And that's a typical story, not for someone that has all that done necessarily, but someone who has 1 or 2 implants put in, it's not a problem.
So pain, because it does seem painful. So I guess
Absolutely.
the bone doesn't really, you don't feel...
Right. If I came in and said, I'm going to put a hole in there and I'm going to put something in your body somewhere, you might think that might be painful. But really what hurts is cutting and opening tissue. And lots of surgeries, whether you have them anywhere in your body, it used to be that way. Everything be opened up. Now with precision and the amazing technology we have available, you can see things ahead of time, so you can go right to where it is, less healing time, and less pain.
Okay, you do public seminars.
Yes.
Once a month?
Once a month.
For denture wearers, people wearing false teeth,
Right.
about dental implants, and I guess their options.
Right.
What do you guys talk about?
Well, the title of the seminar is Change Your Smile, Change Your Life.
Okay.
So the focus is on dental implants. The key thing that we're doing is trying to help people realize what all their options are. Because everybody that comes to the seminar is missing teeth, they have broken teeth, they may have dentures at this point, but what they want to know is, what's my options? There's all this stuff. We're in this information age, right? The internet, TV, and it's amazing to me, people just don't know what's going on. They don't know what they don't know. And that's frustrating to me. And these seminars have been so rewarding. But most of their questions are, what can I do? Am I too old? That's a big one.
How old can you be? Somebody with false teeth watching this, how
Right.
old can you be and still be a candidate?
If you have a jaw with some bone, it doesn't matter. And everybody's living longer. I'm a baby boomer. I'm the tail end of the baby boomers. All baby boomers want to live forever. If you're missing your teeth, you need to have something strong to chew. If you want to live into your 90s to 100, you need to have strong teeth. You need a good diet. And that's what people don't understand.
You say denture wearers aren't really chewing.
No, they're just
tearing their
they're just mashing and just doing that to their food. They're not really chewing. If you can watch people, if you've been in a restaurant, you can pick them out, or at least I can.
I can't. I don't ever notice.
If you see somebody that seems to be like chewing like a cow, they're just really working. They're taking small.
So you see this, by the way,
all the time.
So you could spot a denture wearer.
Yeah, all the
and
time.
And do you think I could help them?
All the time. And there's tens of thousands of people out there like that.
Are there really, like in Springfield?
In
right?
Springfield.
What county are you in?
I'm in Sangamon County.
Okay, how many denture wearers in that county you think have an upper or lower denture?
Tens of thousands.
Really?
Everybody thinks they're alone, and it's sort of this silent group of people that don't, either they're having problems and they're hiding it, either with their hand, or with facial hair, or they're not going out as much, they're not laughing, they're not being social. There's all these things, and we just don't realize it.
So why, if it's so good, if dental implants, like you say, with just 2 implants, you give them a full arch of teeth that snap in, snap out, why aren't they all doing it if there's tens of thousands?
They don't know, Randy. And I had a guy come in, Jim, came in my office. He was frustrated because he didn't like how his lower denture looked. He was actually going forward like this. And I took the denture out. It's all worn. And he's literally positioned out like a bulldog. You could tell he was miserable. But his thing was, I just think these teeth are worn out. And I was like, Jim, what are you eating? And then he started telling me a lot of really bad stuff. But he wasn't even thinking anything of that. And I said, well, how about carrots? You eat carrots? Or how about do you eat steak? Oh, no, I gave up steak a lot. He says, that red meat's bad for you. I said, well, really? I said, don't you like the smell of that? And he goes, yeah, I love the smell of that. But he says, I don't eat it. And I said, well, what if you could? What if you could really chew that really well? Would you be interested in that? And he goes, well, I don't think I can. I'm too far gone. And I said, Jim, we can put 2 implants in here. We can fix your denture. We can fix your face so that you're not all scrunched up anymore, and have that nice smile, and you can eat anything you want. Would you be interested in doing that? And he said, absolutely. But he didn't believe me. He didn't believe me. And at first he was like, and then I told him.
What part didn't he believe?
Well, you know,
That it was that easy, or
he just didn't believe that it was that easy. And, you know, then he was kind of balking about how much it would cost. And I said, well, let's just try that. And, you know, it was interesting. We were talking about before the show. If every patient that had a lower denture, if we could put 2 implants in there for a day and snap it in and say, okay, you wear that for a day, come back tomorrow. If you don't like it, if I literally could take those out, there's no way in the world that they would give them back.
Is it that big of a difference?
It's huge.
Like, what do they say? I mean, do they all say the same thing? Like, I should have done this
years
ago?
They literally grab me by the lapels of my jacket and say, why didn't you make me know about this earlier? And
because you make dentures, like cosmetic dentures at your office.
Yes.
So when you take that person, you give them this snap in, snap out smile.
Right.
They go, how come nobody told me about this?
Exactly.
Or why weren't you guys
Right.
strong enough about this?
Right. And
Interesting.
And something that sort of sneaks up on everybody, it even sneaks up on us dentists, is that they've done studies about how much pressure and how much chewing force you can use with just an upper denture and a lower denture. It's only 10 to 12% of someone like you that has your own natural teeth. And just imagine what that would be like. What could you really chew? Not a whole lot.
So like with these, they can eat like pasta al dente or salads or whatever.
They can eat anything they want. It's like having your own teeth.
Okay.
Years ago, there was a water skier that got implanted, and this is in the 80s, so he went through all the opening the tissue and all that. And this water skier had upper and lower dental implants, had the toe bar between his teeth, skiing professional ski shows in Florida. His dentist was freaking out about it, but that taught us a lot of things about dental implants. It's like, wow, these aren't only strong, they're actually stronger than your natural teeth. You wouldn't do that to your natural teeth without damaging. With dental implants, it's like a rock.
Interesting. Okay, good. Now, you said you show a picture at your seminars to patients.
Yes.
What is this?
Well, here's
okay. So these are your once a month public seminars.
Right. So what I want patients to realize is that a lot of
what is that? Is that the lower?
That's and I apologize. And I apologize for what this is.
It's graphic.
But, yeah. So what you're seeing is the floor of the mouth, but I want what I'm showing this for is I want everybody to realize that that's a full group of teeth. That's the lower teeth. You would agree, right? So that person did not have to have 12 implants to put that in. And I think that's what a lot of people think is they think, wow, implants cost a little money. I have to have one for every tooth. And the truth is this person has a full set lower teeth locked into place, glued into place, if you will. There's only 6 implants in there. And that's a lifetime restoration for that patient. This bottom picture is a little confusing, but it's showing the underside of a denture, and it's showing how there's snaps in there. And we were talking about the snap-in denture. This is an actual model. If you take a hold of that.
So this is the lower
teeth, and would be a lower denture. Now that's 2 snaps, and you notice that snapped out, and then snap back in. So that's huge for all these people that are suffering with lower dentures.
Somebody's in their 80s or whatever, is it sometimes tough to take out?
Yeah, actually, it can be, but we modify it to whatever works best for them. So it's good for anybody. It doesn't matter whether you have good finger strength or not. We can make something work for you.
Okay. Also, denture wearers, you say they're losing bone. That no matter how healthy you are, if you're wearing dentures, elaborate on that.
Right. So in doing these seminars, it's been interesting. They fill out forms after we do it to tell us what they learned. And the number one thing that people don't realize is that when you lose a tooth, you lose bone. And
what does that mean?
Well, that's frightening to a lot of people because if you're losing bone in your jaw, your face is going to shrink. So we use this graphic to show people that when part of the reason you have face height, you think about a little newborn baby. Their face is real tiny. They don't have teeth. As they grow, they get teeth, they get a bigger face, right?
All right.
But then the tendency, and this is our societal, it's not right. You say, well, look at that little old lady. She looks like a baby again. She looks like a baby because she's missing all her teeth, and that's not necessary. If you have lost your teeth, we can put dental implants in there, restore that, keep your bone height, because your body gets faked out. When your teeth are in there, it saves your bone. When you take the teeth out and put dental implants in there, your brain thinks, hey, there's teeth there. They happen to be made out of titanium, but that doesn't matter. So that saves your face. And if you want to look older, faster, the fastest way to do that is just to be missing teeth and not put in dental implants.
Are they ever left without teeth? So a denture wearer is watching this. They go in, you tell them, okay, you're a candidate.
Right.
During the process, they're not without teeth.
Right. So nobody wants to be without teeth. So we always have some sort of at least a temporary solution where if you come into my office, we do a procedure, and you have some sort of teeth, you're going to walk out with teeth. We're attuned to the embarrassment factor with that. So it might not be a final restoration, but it'll certainly be one that will work well for you for time.
Now, insurance and Medicare, I guess here in the U.S., Medicare doesn't take care of this. Insurance coverage does not take care of the whole process.
Right. Well, everybody's got different types of insurance. What we offer at our office is we offer 0% financing. We have lots of ways to pay. So everybody's worried about paying. They're worried about how they're going to pay for it. We've got those covered.
And people say, one of your patients actually said, and we're going to go to a quick break, but it was the best money he ever spent. I think that's something like that.
Not just one. Every patient says that to me. And that's what's so cool about dental implants is you think, this patient spent a lot of money, are they going to appreciate it? They always come back the next day when we put things in. Every time they come in, wow, that's great, Doc. Why didn't you make me do this sooner?
Do they really say that? Like, why didn't you make me do this? Why didn't you tell me about their complaining?
All the time. And
maybe you need to get stronger then.
Yeah, well,
with these denture wears.
It could be because some of these patients, I'll admit to you, Randy, some of these denture patients have been in my practice for a while, and I'll admit that sometimes we didn't maybe push so hard, but I'm not a pushy person. I want them to know. And what I've really discovered in doing these seminars is that it's almost embarrassing to me as a dentist that dentistry as a whole, we have not done a good job at letting people know, hey, we've got some great, amazing options. The technology, the things that we can do now are just mind-blowing. And they're mind-blowing to me. And what I have to remember is that your average Joe on the street has no clue about these things. So I've taken it upon myself, maybe have a little chip on my shoulder, I'm a little hacked off about it. I want people to know what we have to offer.
Okay, good. And you teach other dentists this philosophy. Of options.
Right. Because, you said, dentists, hear, I hate the dentist all the time. And sometimes we take that a little too personally. And so our approach sometimes is, maybe I won't tell them everything. Maybe they'll like me a little bit better. But, but we really need to let people know what's going on. Not to push anything on to them, but we have to realize how little people know. And our job is, doctor, actually, I think in Latin or Greek or something, part of that means teacher. We're supposed to be teaching people about what that is. That's our obligation. And then when that patient decides to do something, well, great. But maybe if I have to be pushy, I need to push a little bit more about dental implants, because there's going to be a time when everything's going to be attached to dental implant. If
so
you're
the
missing
future of
something,
dentistry, traditional dentures are out. They'll be attached to something.
They're going to have to be.
Now, what about people that know that they have sore gums? Already their denture hurts.
Right.
Won't the implants also hurt once you get that done?
Right. Well, what the implant does is it sort of lifts lifts your appliance off the tissue. And even if it doesn't, a lot of times people have sores in there. There's infection in there. And that's another thing. People don't realize when they have gum disease and bad teeth, it's not just that they're rotten. It means that it's infected. A lot of my patients tell me how great they feel just getting their teeth out, because what we've done is we've literally extracted the infection out of their body. And, if you had an infected sore on your leg, you'd be a little concerned. And you would agree that if you clean that up, you'd be feeling a little bit better.
So people that they have bad gums, they can still qualify for dental implants.
Right, because the source of the bad gums is the infection, which is usually lashed around those infected teeth. So get that out of there.
So all ages. I mean, you could be 80, 90.
Absolutely.
What's your oldest patient?
The oldest,
for one of these snap-in, snap-out.
The oldest
dentures?
patient recently I've had is in her later 80s.
Really?
And so we put.
What does she say?
Well, we put 3 implants in her, and now she can chew stuff that she hasn't eaten before. That, she's somebody who's in front of the public, so she was very concerned about how is this going to look. So we made her those cosmetic.
So a full arch of teeth, 3 implants.
Right.
And it just snaps in, snaps out.
On the bottom.
And there's no more adhesive, right?
No. And she does well with an upper denture. Her concern was she wanted to look good because she does tours for people, and now she's not worrying about, hey, that lower denture spilling out, because you have to realize it's not just about, as dentists we're always thinking about functions and so on, about chewing and how does it look, but you forget about all these other things. Just talking to you, I have my own teeth. I'm not sitting here worrying, are my teeth going to come out? Yeah. But denture wearers, that's what they're thinking about. They're thinking about.
You said they go to a restaurant and they're looking at it, wondering what they could eat.
Right. Right. You know, it's talk.
Very interesting.
Right. You know, there's people look at menus different ways, right? Sometimes people look at the left side of the menu because that's the least expensive thing, and they don't want to even look at the right side of the menu. Well, these people they're just combing through trying to find, okay, what can I eat without embarrassing myself in front of these people that I'm sitting and eating dinner with.
Okay, with denture wares, is it a tipping point where they finally had enough of their denture? I mean, where, because I know my mother, she said one day she woke up and she's married, and her denture was in the covers.
Right.
And she said, I got to do something about this.
Right. And she made. And
is there a lot? Was that common, by the way?
Well,
where they fall out or something happens?
Yeah. Well, I can tell you lots of stories about things falling out. I've got a patient who he came into me first because he has broken lower denture. I said, what happened? He goes, it's kind of embarrassing. I was leaning out of my truck. There's this gal at work. She's a dispatcher. He drives a truck. He says, I was leaning out, and I was talking to her, and my lower teeth fell out and cracked in half at her feet. And he's like,
bad.
Oh, my God. So he had a broken denture. Pretty much broke his chances of.
So he called you to fix the denture, obviously.
Yeah.
Did you get him some dental implants?
Well, then we talked to him. He said, hey, Doc, can you just glue this back together? I go, well, do you want that to happen again? He said, absolutely not. And I said, well, let's snap them in. And so we did that for him. And I don't know if he ever got back together with that some woman, but he's a much more confident guy. And he's a really nice guy, but now he's confident. And that's the difference.
You say these people that beyond just having a fixed set of teeth, they could eat and chew and things like that, but the smile changes their life. And,
right.
and you're a dentist, and
right.
I always think, of course, you're going to say that.
Absolutely.
How important is a smile?
Yeah. So, what I always say is your smile defines you. And you'll admit, anybody will admit, when we look at people, we judge people. We're not supposed to, but we make snap judgments, right? So if you look at a person and their teeth are pretty good, you're going to think, that guy's probably pretty good in life. He's probably doing all right. You see somebody who's missing teeth, they're broken, things are moving around, you're going to think, oh, that's broken. That's probably a broken person. So,
or like they don't have money or something.
Right.
Or education. Or
right. Or if you're interviewing for a job, who do you want? The person who looks good or the person who looks broken?
I mean, if they're smiling and happy.
That's another one.
That would do it.
They might be just keeping their lips.
If somebody's not smiling because they're hiding something, obviously, you can think that they're moody or depressed or whatever.
Absolutely. So there's all these things going on, all these psychological things going on. And it's really about right here, what's in their eyes and what's on their smile.
Okay, we're going to take a quick break. When we come back, I want to know about the process, also about the next level up, a fixed set of teeth.
All right.
Teeth that do not come in and out for the people that have dentures.
Absolutely.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Well, then I came in to have new dentures made, and they talked about having these implants, and you explained what those were. And I said, this is fantastic. I said, well, I don't do pain very well. So I had the implants put in, and it's fantastic. We should have had these 50 years ago. They're a lot sturdier. Your bite's a lot better. The plate doesn't float around. It's just perfect. I can talk fine, but the biggest thing is I don't have to use the adhesive anymore, and I have a very strong, sturdy bite. It feels fantastic. This is one of the best decisions I ever made. You're fantastic. This place is awesome. You can get me right if I have a problem. You get me right in. You adjusted my teeth. You took a lot longer, I think, than my original dentist. I mean, you work with me, seemed like, for hours at a time to make sure I had the right fit, the uppers and lowers. And again, you checked everything. The bite was right. They're just perfect.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more traditional dentures. With as little as 2 dental implants, according to my first guest, you can get something that snaps in, snaps out, no adhesive. Dr. VanderMolen. Okay, Dr. VanderMolen. Okay, so the next level up, and we're just about out of time, people could come in that have false teeth and could get a fixed set of teeth.
Right.
Tell me about that.
So a fixed set of teeth, this would be an example of one, is where you have something that looks like a denture. It's an abbreviated type denture, but it's actually screwed down into place. For that, we need more than 2 implants. Typically, you're going to need 4, 5, or 6 implants to hold that into place. Now, when you have a fixed set of teeth, you have something now that you're not thinking about. So think about it like as an example. Do you ever think about when you walk somewhere, do you think about, I put one foot in front of the other?
No.
Right.
I also don't think about my teeth very
right.
often.
Right. So you have your own teeth. You just put something in your mouth, you chew. You just talk. You don't thinking about Okay, do I have to make an adjustment? So if you have something that's fixed, it's locked into place, that's gone. The only thing you have to think about is that you do need to clean around them, and you need to come in and see us every 6 months.
Like every 6 months?
Just like a normal people with regular teeth.
And they could eat what?
They can eat anything.
Is that right?
So you pick it. I always ask my patients, do you want to eat what you want, or do you want to eat what you can?
Can they chew gum with a fixed set of teeth?
Absolutely.
Is that right?
It's like your own teeth. It's actually strong. When we were talking earlier, I was talking about that water skier that holding the tow bar in his teeth. Dental implants are actually stronger than your own teeth.
Okay, good. I want to thank you for coming on the show. We're out of
Thank
time.
you, Randy. Appreciate
excellent,
it.
Excellent stuff. So call your office, make an appointment.
Yeah, we offer
IV sedation. You could go in and just...
If you want to sleep through the whole procedure, we can do that. If you want to just find out, look, people come to my seminars. There's no pressure. Come to my seminar. Come into my office. Everything, we're offering a complimentary consultation.
Mm-hmm.
We'll do the 3D scan. We'll do everything, and we'll let you know, hey, you're a candidate for implants, or maybe there's something a little less. Maybe you think your teeth are worse than they are. Maybe you don't need dental implants, or to the extent that you think you might. Come find out what it is. My mission is that you know your options. We're not doing a good job in dentistry to let people know their options. Just come let me help you do that.
All right, thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you'd like to see this interview again, you could go to our website at wellnesshour.com, put in Dr. VanderMolen. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.